welcome everyone to our Ask Me Anything on the COVID-19 Toolkit for Businesses. My name is Sarah Mostowich, and I work at Communitech as an innovation consultant and as program manager for the Stay Safe at Work program, where we're working on bringing rapid screening to organizations and individuals all across Canada. I'm super excited to be with you today moderating our AMA. Just a reminder of a few upcoming events that we have in the next few weeks or so. Please be sure on a weekly basis to check your startup newsletter as well, as there's always new events that we're adding to our repertoire. So without further ado, I'd love to bring up our panelists that we have presenting today, starting with Dr. Jim Chung, who's the Chief Medical Officer at Air Canada. We have Neena Gupta, who's the Practical Employment Law Advice Partner at Gowling, and we have Tushar Anandasagar, who is the Associate of Employment, Labor and Equalities at Gowling as well. So we'll invite Dr. Jim Chung up first to share a little bit about himself and some opening remarks.
Thank you, Sarah. I really appreciate the opportunity to come here and to speak to everyone. Certainly, you know, this COVID-19 has been particularly difficult for the aviation sector. So happy to share any experiences and lessons learned that as we've sort of worked our way through this.
Awesome, thanks, Jim. And we'll go to Neena to introduce herself as well.
Everybody, my name is Neena Gupta, and I'm a partner at Gowling WLG. I'm known for my sense of humor and my love of horses in the firm, and I'm looking forward to speaking to all of you.
Wonderful. Thanks, Neena. And Tushar.
Thanks so much, Sarah. My name is Tushar Anandasagar. Thanks everyone for joining us this afternoon. And since Neena led off with a fun fact about horses, I also like horses, but of the automotive variety, horsepower. And yeah, we'll leave it at that. Empty roads during COVID, not the worst thing. Not so looking forward to the traffic once we reopen everything.
Thanks, Tushar. So really excited to get into everyone's questions. I know we had a number of people who sent in questions, and so much for that. Just a quick kind of ground rules and expectation setting for this Q&A. We won't have the opportunity to handle specific organizations, kind of nitty-gritty questions necessarily, you know, in this open forum. So we'd really like to focus more on general open-ended questions that each of the speakers can speak to. And if anyone has any more specific questions or specific scenario that you'd like to get into with any of the panelists, then we'll invite you to reach out to your customer success advisor after this AMA, and they'd be more than happy to put you in contact with the appropriate individual. So as we get into the questions, I'd like to start out with Dr. Jim Chung. And it kind of seems like Air Canada has really been on the leading edge of practices to keep workers safe throughout the pandemic. So Jim, can you give us a bit of an overview of how COVID-19 has impacted Air Canada throughout the pandemic and all of your business operations, and also what you folks are doing now related to COVID-19 protocols?
Yeah, oh, thanks, Sarah. You know, as I sort of mentioned earlier, I mean, it'd be hard pressed to find another sector as heavily impacted as the aviation sector at this point. I think we're only flying about 5 or 6% of what we were sort of pre-COVID levels of passenger traffic. We were very proactive, and this really started before COVID even hit, though. And I even like how it traces back to the beginning, to Ebola, to be honest, where we noticed that, you know, there was a big gap in our early warning intelligence with respect to infectious disease, and we did sign up a partnership with a small AI company called Blue Dot in Toronto that does early warning through health intelligence, through artificial intelligence. So it's a really interesting, really keen company led by Dr. Cameron Kahn that provided us some a little bit of early warning on trends, on sort of potentially infectious disease trends, though. And you know, that gave us the ability to prepare a little bit for this coming, but you know, not to the scale that we ever thought it would end up being. We did start early with issuing masks for our flight crew and our cabin crew, essentially in January. We followed that up with starting up temperature checks on our passengers. Again, like with the airplanes themselves, having the HEPA filtration, looking at expanding into what we call our Clean Care Plus program, which is sort of sanitization, hospital grade disinfectants with electrostatic spares on board aircraft, and really trying to reduce sort of touch points and making things as touchless as possible throughout the journey. So we've been very proactive in areas that we can be to reduce the risk for our passengers and for our employees.
Awesome. Thanks for that. And you mentioned masks and sort of low touch pieces. Are there any other things that you're using to help keep Air Canada employees safe?
Yes, absolutely. So for our employees specifically, there's multiple sort of programs that we're doing. One of them is employee rapid antigen screening, which I'm very proud of being one of the first ones to start that. But we've also sort of partnered and piloted with a couple of companies, Thrive Health, which does a wellness app that we were using, as well as TraceScan, which is a contact tracing app or wearable, involving use of wearable technology, that we can sort of rapidly sort of identify those that are sort of meet that criteria of exposure, that's 6 feet or 15 minutes in proximity of others very quickly. And we've been very proactive with doing our own internal contact tracing on our employees for any positive cases.
Awesome. And how have employees been responding to these so far?
It's been very great. I mean, we've had a lot of uptake, certainly, certainly for the employee screening, for example, averaging about 40-50% of voluntary uptake on employee rapid screening. All our, we've run periodic surveys on our employees as well, and then it's been 95% plus have been very satisfied with the program, with doing screening. And certainly, same thing with the TraceScan app and the wearables. It's when you get into a couple of incidents and you see the utility and how useful this is, and it's very easy to get buy-in.
Absolutely. And you mentioned the TraceScan app. I think that's probably something that people can relate pretty closely to, at least, most people have app. But you mentioned the rapid screening as well. Could you dive into that in a little bit more detail and maybe paint the picture for folks of exactly what that looks like for Air Canada?
Well, for rapid screening, this is, we've been very fortunate in that we were one of the early companies to sign up with the Creative Destruction Labs Rapid Screening Consortium, which with a like-minded company such as Rogers and TELUS and Loblaws, to really look at solutions, not just for the industry, but just overall solutions for Canada, using rapid screening, though, or rapid testing. Given, what we know about COVID, that 30-40% of folks who have COVID are really asymptomatic carriers, and hence the problem that we're having with why it's such a big pandemic. And we've experienced this in our own workplace as well. Now, with the rapid antigen tests that are currently available, be it the PanBio or the BD Veritor, and there's several others sort of in the market here in Canada. They're very fast. They're very easy to use. Certainly, we initially started out doing screening where we've had our employees screen themselves, essentially do their self-administer the swabs and then process it and put a couple of drops into what looks like a, for want of a better term, a home pregnancy test cartridge, 5 drops, and then allow it to sort of process through what we call lateral flow assay. And if it's one stripe is negative, and if it's 2 stripes, it's a positive test. So it's very simple to apply. And in fact, in other countries in Europe, for example, they have 6-year-olds running doing these tests on themselves in their classroom. So it doesn't require, quite frankly, it doesn't require a medical doctor to run this test. And so I'd highly encourage that. It's become much more available. I highly encourage folks to use it.
Sounds like a great tool for people. Could you talk a little bit about vaccines? I think that's really top of mind for people as we're hopefully looking towards more broad reopening. What is Air Canada doing around vaccines?
Yes, and we really hope to get to that point where people are getting their second vaccine, and are hopeful that it'll be much sooner than there'll be a much more accelerated timeline. We've been very proactive in the vaccine front. We have 3 vaccine clinics that we're participating in. One in Coquitlam, BC, supporting the Fraser Health Authority, running their community clinic, and we have a vaccine clinic in we call our Montreal hub, in conjunction with Bombardier and the Aéroport de Montréal, sort of doing vaccinations for employees, but also for the community. And I'm sort of proud of what we just started up last week in Peel, as we started our employer vaccine clinic for our employees, our families, surrounding community partners as well, such as the hotel workers and Jazz and other sort of affiliated partners. So we've been very proactive with getting vaccines out there and seeing that is part of the solution for us.
Absolutely. That's incredible. And how have communities and employees been responding to that?
One of the things that with giving vaccines out is actually, people have a sense of relief or anxiety. Everyone has a high level of anxiety, but they all see their shoulders kind of relax once they get their vaccine in them. And even my wife just said that the other day. Like, she just had a underlying level of anxiety until she had that first shot, and so the relief and the joy, quite frankly, that people get after getting the vaccine is very rewarding to those that when you vaccinate. So.
Absolutely. And I'm curious for Neena and Tushar, legal perspective. I imagine there's lots of employers that are wondering this. What can you do around vaccinations? Are employers able to make vaccines mandatory, or what would you recommend there?
So I'll start with that, and I want to apologize to everybody who's on this call, but I live on a farm and my power went off, so I'm on backup. So if I disappear, I'm being rude. It's just another COVID-19 thing. So mandatory vaccinations have been bruited about, and it's not easy. So in Jim's situation, he's in a unionized setting. And so any kind of new management policy has to essentially involve discussions and ultimately, quite frankly, the support of the union, because you don't want to have dozens of grievances or a big policy grievance. For those of us who are not in the unionized sector, it's not so easy to tell an employee they have to have a medical procedure. So here's what Tushar and I have been working on, and let's be practical. First of all, let's work on the theory that we have a duty to have a safe workplace. That's one of our primary obligations under occupational health and safety. And let's figure out what we absolutely really need to do to maintain that safe workplace. It doesn't always have to be vaccinations. We can talk about proper masking, social distancing, rapid antigen testing, PCR testing, a whole gamut of tools to help keep us safe, including better HVAC, better hygiene. On the other hand, and we'll talk about this in greater detail because I know Communitech is all over this, as we can think of techniques such as rapid antigen testing and that may help reduce risk. So we're really looking at the full toolkit. There may be possibilities, particularly where you're dealing with vulnerable people, and I mean healthcare, childcare, daycare, where you may actually, as an employer, be able to say, in order to work in this workplace, you need to be vaccinated, and if you can't be, we won't fire you. I mean, nobody wants to fire anybody. We just are going to have to figure out how to accommodate you, or maybe even figure out some way of keeping you on the roster until it's safe for you to come back. Nobody should have to get COVID-19 in the workplace, and nobody should have to die of COVID-19 because they wanted to go to work. So it's not an easy question. And for those of you who are contemplating a mandatory vaccination policy, I recommend that you make Tushar and I, or your lawyer of choice, your next best friend.
Thank you so much, Neena. Maybe I could pop in for a couple of remarks on some of the existing laws and regulations that maybe might be parallel to the mandatory vaccination question in the sense that we're looking at now, because we're looking at COVID-19, but I believe there are some precedents. Is that correct? There are some precedents in other spaces that perhaps could allow for the establishment, at least theoretically, of a mandatory vaccination policy?
Yeah, I look to a couple of things that are happening. First of all, Quebec and Italy have both said mandatory vaccination, but they've restricted that to the healthcare setting and in Quebec in certain aspects of the healthcare setting. 2, we effectively require vaccinations in the daycare space, in the, to a certain degree in the school space. I mean, many of us who have children remember having to fax in. Yes, we used to fax in vaccination certificates in my era. And finally, I mean, we're focused on COVID-19, but there are other things where people have said you need to be vaccinated. So you need to be, many nurses have to be vaccinated against measles, mumps, rubella, and similar, diphtheria, polio, tetanus. So they're required to have those shots. And part of the reason why that's considered to be okay under the charter, under the Human Rights Code, is because the seriousness of measles, mumps, rubella, et cetera, I think COVID-19 will be treated as being fairly serious. We have had 25,000 deaths from COVID in Canada. The Economist believes that the real death count in the world is closer to 10 to 12 million. And so definitely more than other diseases that we consider to be serious enough to require vaccination. Now, if you're a law firm in downtown Kitchener, like we are, Tushar, I'm not so sure that mandatory vaccination is necessarily going to work for us.
That makes sense. And Neena, you had mentioned a little bit earlier this concept of a COVID-19 toolkit with strategies like vaccination, but also obviously social distancing and mask wearing. You mentioned rapid antigen screening as well. Can you expand on that a little bit more and talk about maybe what a COVID-19 toolkit looks like for businesses?
Well, the first thing in your toolkit should be your COVID-19 health and safety plan, because that's mandated by the Ontario government. And I'm constantly shocked getting calls from my clients in a panic saying, we had our first positive COVID-19 test result. What am I supposed to do? And I said, well, remember last year we worked on your COVID-19 health and safety plan? Did you look at it? Because it tells you what you're going to do. And typically at some point in time, it looks at calling public health for advice. That tends to be a big part of the tool. We've talked about things like physical separation, plastic barriers. We've talked about masking, and I'm going to make a shout out and really recommend that employers insist on medical grade masking. We all did our thing. We all did the pretty cloth masks. We use bandanas, we use scarves. Now in Canada at a very cheap price, you can get real medical grade masks. Let's use them. And we're not taking them away from our healthcare practitioners, which was a concern a year ago. Other things that look in your toolkit is whether or not rapid antigen testing. I know in Waterloo, and I am on a farm in Centre Wellington near Guelph, you can get free rapid antigen testing kits that are, quite frankly, very easy to use. They're sort of like a cross between a Q-tip and a pregnancy test. I guess the men on the call may not be familiar with it, but I'm telling you, it's not hard. And Tushar, you've actually looked at some of the legalities and practicalities of rapid antigen testing. And I'm wondering if you want to share what you've learned over the last few months.
Definitely, Neena, happy to do so. And so I guess the starting point on the rapid antigen testing side is maybe we can sort of split the inquiry into two categories. One of which very much involves public health. They would effectively be integrating into a given workplace. It's called the PASP, the Provincial Antigen Screening Program. And so that's sort of category number one. We'll leave that aside. We're more interested in the privately initiated rapid antigen testing, which effectively operates outside of the public health sector. And that particular type of testing is the one that Sarah will have spoken about earlier, that Communitech has spearheaded in the local region. That is of significant interest it should be of significant interest to employers across the province, because it is step one, or could be step one as part of a screening protocol. And I think a starting point for privately initiated testing is going to be reviewing, number one, the requirements under law, and number two, making sure that you're covering off the key sort of exposure points that an employer could face, because you're not operating within the bubble of the public health sort of sponsored program. And so what does that look like? Number one is obviously operational. There has to be a supervisor to supervise the people that are swabbing themselves. It's called supervised there's my tongue twister of the week, supervised self-swabbing. Number two is going to be from an administrative standpoint and operationally. How are you going to cover off legalities under privacy laws, under consent to collection, use, and disclosure of information laws? Are you going to be collecting this information? There are elementary questions that an employer needs to ask as they sort of move through this. And so a good starting point is to check the rules that apply in your specific public health region, because they tend to vary from region to region. Some are requiring reporting, others currently are not. There are provincial announcements that sometimes say that reporting will be required, others that say that we're going to be changing the framework for the time being. So this is very much a new and moving target, but the starting point should be touching base with your local health unit and determining which requirements apply in your region. And if you have any follow-up questions about this, we have been living, breathing, and working on this for the course of the past 5 months. So happy to jump in.
Yeah, one other thing I'm going to suggest is look at your own policies. I'm really encouraging employers to use the carrot and not the stick. And that you can call it a vaccination incentive policy or a revision to your sick leave policy, but essentially allowing people paid time off to get their vaccine, so that for many people, particularly those who are on a lower hourly scale, it's really hard to afford taking a few hours off to get that to get the vaccine. And I've seen employers essentially give a no questions asked extra day off if people come in and say, you know what, I took the vaccine, it hit me like a ton of bricks, I'm not coming in. We're not kind of making it a difficult thing. We're not subtracting it from their sick leave bank. We're saying, fine, just stay home and thanks for getting a vaccine. Yeah, some people will abuse it. I realize that, but you can't deal with everything. And most employers are saying encouraging people to get the vaccine is more important than worrying if 1 or 2% of our employees are cheating the system. And then finally, and this is not a legal requirement, but it's a human suggestion, people continue to be anxious about vaccines. There is something weird about getting a needle and injecting it into your body. As a species, we typically eat things. We don't typically inject things. And so there's that underlying anxiety. And then there's just all the other questions that none of us on this call can answer, like, I'm pregnant, should I get it? I just got off a really nasty cancer regime. Will the vaccine work? Should I even bother? Larger employers are actually inviting personable, good medical communicators to have honest and sympathetic conversations. Because I would say, yeah, we hear a lot about anti-vaxxers. I think a larger group is vaccine hesitant or vaccine warriors, or just not entirely certain, because there's so much information overload. And so having that ability to talk one-on-one with somebody who is not pounding you and saying you're stupid for not wanting a vaccine, but trying to address your underlying anxieties is a huge step in the right direction. And they've done studies on nurses where the nurses have the ability to ask these questions, and they've vaccine hesitant. I recognize there's always going to be a group of people who just don't believe in vaccines, and I don't know if I can reach them. But for the people who really are trying to do the right thing but just don't know and don't know who to believe, that friendly face on a call can be really important for them. So there's lots of things in your toolkit to help fight COVID-19.
Neena, maybe just to follow up, you made some very good points. One of the other sort of policy issues with rapid antigen screening we found is you actually also have to develop a policy for time off for those presumed positives. So we've done about 30,000 tests, and we've had about 35 positives, 1 false positive. So about just a little under 1 in 1,000, 1 in 750 or so. Every test is positive. And so, one of the questions your employees ask you is, what happens if I'm at positive? and I'm waiting for my PCR test to confirm I'm positive, and then I'll go on COVID leave. So we do provide a 3 days of paid time off as they get their PCR test until we get the confirmatory PCR test positive. In terms of the vaccine hesitancy, I fully agree with you. This is something that we've been struggling with. We kind of feel there's about 50% of our employee base are crave the vaccine. They'll stand in the rain for 4 hours and line up to get the vaccine. 25%, you could talk to your blue in the face, and you will not sort of change their mind, and they're vaccine not even hesitant, but just vaccine skeptic. And our strategy really is you're wasting your time and energy with that group. And it's that vaccine hesitant and vaccine kind of confused group, that 20-25% that we're kind of focusing most of our efforts on. Though, we've partnered with the Cleveland Clinic Canada, ran some town halls on vaccines, some Q&As, which have been very helpful with that. And hopefully, we've created a bit of an uptake because of that.
If I could just add, Jim, there's statistics showing that the vaccine hesitant group is shrinking in Canada because of those types of efforts. But also, if you keep seeing on Facebook, or if you keep hearing on the radio that people are getting vaccines and yet they felt tired, it may have hit them like a ton of bricks, but it didn't kill them and it didn't hurt them permanently, that creates a familiarity and confidence that no amount of public service messages can do. So I'm glad to say that the people who started in January saying there's no way I'm going to use a vaccine, they developed it too quickly, are because they see millions or hundreds of millions of doses being administered, some to their friends and family, are much less hesitant too. So I think we can chip away at the people who rightfully have some concerns and questions and want them answered.
Absolutely. And I'm curious, Jim, for Air Canada, it sounds like you folks have been, running lots of programs around vaccines for a while. Is there anything that you did that you felt resonated the most with employees or kind of made the biggest difference when it came to, getting people out and getting people vaccinated?
Well, we started a vaccination campaign. First of all, I think maybe we have a unique employee group, so because a large group of them are sort of public facing and exposed, so they had a great deal of anxiety, sort of to begin with, really, just because they were sort of in the public. So we didn't really have to do a lot of convincing for a large percentage of our employees, but certainly we did have a campaign through our employee communications team called Vaccinate, with the AC in big letters, just as our branding, and really, one of the things we had on our social media, internal social media channel is reasons for why you're getting the vaccine. Like, you're getting it for your grandma, you're getting for your cousin or your partner, or because you're a cancer survivor, something of that sort. And so we encourage people to post their stories about why they're getting the vaccine, and that really gained a lot of traction and really just fed on itself.
And thanks for sharing. And Tushar, I know you connect with businesses quite often, at least certainly around the rapid screening side. Is there anything that you've seen that employers are doing that's really resonating with employees?
Absolutely. I think that it's incidentally convenient that you're talking about rapid screening, because I was looking at one of the questions that popped up in the Q&A, and it says, can you talk about what makes sense for a small non-unionized company and return to work strategies for what you can legally request your employees to do? Rapid screening comes to mind as a key strategy that a small company, we're looking at the prospect of a return to work. We're looking at the prospect of full vaccination, but rapid screening is actually happening now. And so if you have your policies in order, if you have your training in place, if you have your protocols in place, you're ensuring that you're covering off legal risk and liability, that is definitely something that you could be doing here and now, and that is resonating a lot with employers that are both local as well as throughout the province of Ontario, regardless of the size of the operation. Another thing to keep in mind too is that there's been a lot of coverage over the course of the past several weeks about these class orders that have been happening in specific jurisdictions. So we're talking about Peel, Hamilton, Toronto, 5+ cases, and then and then you're shut down. The local health unit will shut you down. One of the key strategies that we are recommending to clients to, number one, avoid, and number two, deal with these types of issues, is to screen employees, to establish these protocols and treat it like steel-toed boots. A rapid antigen screening is so much less invasive than a standalone PCR, leaving aside the concept of a medical procedure, a vaccination. We're talking about something that is as easy as brushing your teeth. And so, if you can work with the here and now and administer this as part of your overall health and safety strategy, I think that really merits looking into at this stage.
I know you mentioned the concept of businesses potentially getting shut down, and I know, at least from work on the Stay Safe project, that seems to be top of mind for businesses. As they're worried about doing a rapid screening program because what if that makes their COVID cases known, and this way they might get shut down? Can you just speak on that a little bit?
So if I could just refine that a tiny bit, you have to understand that our public health officials don't want to close down business. It is truly only if they believe that's necessary to protect the health and safety of your workers. If you are screening employees before they are coming back to work, presumably they got COVID somewhere else. And those class orders Tushar talked about, which are really kind of almost codifying the authority they had before, those class orders are designed to deal with COVID in the workplace. So think about what we heard about last year, the large meat processing plants, the large distribution centers, where it was clear that they were part of the spread. One thing that no officer has really successfully dealt with is the fact that people carpool for environmental and cost reasons. But I mean, spending 45 minutes in a car with 4 of your coworkers has got to be the worst kind of spread, situation. So I do believe that we need to sort of look at it from a rapid antigen testing as a way of avoiding further spread in the workplace. And if we marry it with Jim's suggestion that you create policy saying, okay, you're positive, we're going to tell public health, go home, we're going to give you a paid day off, don't come into the workplace, don't spread it to your employees, and for God's sakes, don't spread it with your colleagues and your home. Like, people are spreading it at home because they don't even know what isolation truly means, or unfortunately can't isolate properly. So I think it's actually a tool to keep businesses going. And the second tip I would give you is, if you're proactive and you think about ways of organizing your workplace, you may be able to figure out a solution that is short of closure. In other words, if you're a construction company, maybe it's the crew that was at a certain work location, but you're not blending crews, so you don't have to shut down other locations. If it's a manufacturing plant, maybe it's one assembly line, but not all of your assembly lines, or maybe it's one shift and not all of your shifts. So we have to look at the workplace almost like amateur infectious disease specialists to see ways of persuading the public health office that we can keep our employees safe without a total shutdown, because they don't want to shut down essential services and people's jobs if they can avoid it.
Sarah, I'm going to also add, though, for screening, though, I understand that's the concern, but I would probably just reframe that and look at it from a different lens, though, in that if you're not doing that screening, you're letting it fester in your workplace, and it's actually going to compound the issue, and you're going to have a bigger problem. And when you do see it, I mean, it's kind of the iceberg principle. Then instead of a little iceberg, you're going to have a huge iceberg, though, when you detect your first case in the workplace.
Yeah. And I would say, from having worked on the Stay Safe project myself, we've been working with public health units, across at least Ontario. And I think the biggest message I can bring is they don't want to shut you down. They're not trying to be the bad guy, right? They're just trying to help businesses and help employees operate as safely as possible. So it's not like this, this big scary organization that's trying to shut down your operation and lose you money. It's really just them trying to help you, operate safely as best you can. Great. Switching gears for a second, I wanted to talk a little bit about the privacy side of things, because whether it's with rapid screening or with PCR results or with even vaccination records, I know a lot of employers are concerned about what type of employee information can they hold on to, and are there any privacy or security concerns with that? Neena, can I turn it over to you to talk about that?
Yeah, I'll certainly start. So for most of our listeners, and I did kind of look at the participants list, they're mostly Ontario based, and I'm going to assume that they're Ontario regulated. If you're federally regulated like Jim and Air Canada, the federal privacy legislation does apply, and it does apply to the employment sector. In Ontario, there's no general privacy legislation that applies to employees. There's a little bit that might apply to most of the callers here, which is the Personal Health Information, Privacy of Personal Health Information and Protection Act. You know, I'm not entirely certain, but in general, if you do it on a, do I need to know this information and for what purposes I'm using it, and restrict the information conceptually to those people who need it for the purpose you've identified, and you are candid with your employees and tell them what you're going to use that information for, and they consent to it, because consent and disclosure are the magic tools in privacy, I think. You've probably dealt with 95% of your privacy issues for Ontario regulated employers. For federal employers, it might be a bit more complicated. And Tushar has been working on this, and I think we've navigated privacy issues quite well, right, Tushar?
I think so, Neena. I mean, one of the key things that we considered sort of early on, and especially as the first couple rounds of vaccines were announced, was what are we going to do with this concept of a vaccine passport? So we talked about the vaccine passport. What does it look like? Is it electronic? And then we look at the sort of first principles that have evolved over the course of the past, 100+ years in terms of health information and the regulation of health information under law, and this concept of minimal impairment and intended purpose starts, both of those concepts, they start to kind of come out. And so what do we mean by minimum necessary impairment or minimum necessary protocol? Do you actually need a copy of someone's vaccination record that says, I went to Shoppers Drug Mart on Saturday and I had it in my right arm and it was administered by, so-and-so, and do you actually need that for the purposes of administering the employment relationship? Not quite sure you do. And there might be other reasons why an individual employer might need it. Others may find some sort of middle ground, and some might say, I don't need it at all. Flash it on the screen, and I'm okay with that. Or it may be asked, it may be requested for purposes of administering a vaccination incentive, for instance. If you have a vaccination incentive policy or something along those lines. So I think the purpose needs to be tailored, and the retention of information needs to be tailored for a particular situation. But I think the foundational principle is that you need the minimum necessary information possible in order to achieve the desired result. And I don't know necessarily that we need to keep a record of someone's Shoppers Drug Mart receipt saying that I've been vaccinated in my right arm on X date. That might change over time, but not at this point, I don't believe so.
Right. And so, for example, it might be if I want to get my 3 hours paid, that I need to show I actually went to the appointment, but you don't need to keep it. So I have a client who simply is literally going, vaccine, evidence seen, date, but doesn't keep the actual receipt because they don't need the name, they don't need the health card number, they don't need to know whether it was Pfizer or Moderna. They just need to know, yes, they got it, and they're going to authorize a payment of 3 hours. And so just, keep that in mind, but understand that in most cases, I think there's going to be a lot of sympathy for employers who are trying to do the best they can. And so as long as you're not being ridiculous, I think that you'll be told don't do it again, but you're not going to be facing huge fines.
I guess the question as we look forward though to the 2-dose summer or fall, whatever it's going to be though, and anticipating that we'll have at some point the Public Health Agency of Canada will actually provide some guidance like the CDC, and advise that people that are fully immunized can go about without masks and can socially congregate. Then, is there like an expectation in the workplace and to have that verified, like those to have a 2-dose vaccine?
Yeah, and
record?
we're still for the Canada to make kind of announcements of what it will look like. What will people be permitted to do if they can prove they have 2-dose vaccines? And the example I want to give you, Jim, is that if you can prove that you're fully vaccinated, you can actually buy tickets and watch a show in Broadway. And I'm a sucker for Broadway. So someday Air Canada is going to fly me to New York so I can go and watch it, get my fill. Well, are we going to do that in Canada? Will the Hillside Festival in Guelph, which is where I live, be able to continue at some point in time for people who are fully vaccinated? And will there be other regimes? Like, so in Barcelona, what they did is they essentially said, okay, fully vaccinated, or you do a rapid antigen test to prove that you're negative. So will we have to start creating protocols, and what kind of data security and how will we authenticate that information? So those are questions far above my pay grade. I will tell you that I attended a panel with IBM, and what they are doing with blockchain to actually verify things without having necessarily a connection to the internet or having to dig into a database. Just authentication, yeah, you're good, is unbelievable. And so I invite Sarah and the group at Communitech to actually have a discussion about this amazing technology. But I think we're going to see it. I know that privacy and civil libertarians are very concerned because it may actually function as a way of stigmatizing or excluding people who actually can't get vaccines. Because one thing we've talked about the vaccine hesitant, we've talked about the vaccine skeptic, but there's actually a small group of people who legitimately cannot get vaccines. And so those people are protected under the Ontario Human Rights Code, and we shouldn't be stigmatizing them. So how are we going to protect them from being unfairly stigmatized? And incidentally, they're often the most pro-vaccines, even though they can't get those vaccines themselves.
Absolutely, that's a great point. So I'm just looking at the clock here, and I want to give a chance to kind of wrap up and say a couple of closing remarks. So I'd like to hear from each of the panelists. As we wrap up, do you have any recommendations that you would provide to business leaders of, if you could suggest to have these few things in their COVID-19 toolkit, then what would your suggestions be? And why don't we start with Jim?
Yeah, thanks, Sarah. Thank you for the opportunity to speak to this group today. Really, I guess just planning for the future. Have a vaccine policy in place. Have a rapid, incorporate rapid screening into your return to work sort of process, and certainly enlist in very smart lawyers like Neena and Tushar to help you assist you with your policy though, because certainly it is complicated. No one has the right answer for us. Quite frankly, because we're all sort of learning as we go along, given that none of us have experienced a pandemic before. So that's it. Back to you, Sarah.
Thanks, Jim. And Neena, how about you? What are your top recommendations for business leaders?
I think communicating is really important and explaining why you're doing things. And I really think your workforce wants to be back at work, but they are rightfully afraid. And so really understanding that in figuring out your policies. I think one of the things we haven't talked about a lot, I think one of the Q&A mentioned it, is that we're going to see a different workplace, and we're going to see
I think we may have lost Neena. Maybe her power cut out. Maybe Tushar, I'll hand it over to you for your closing remarks, and hopefully we'll get Neena back in a few minutes.
Oh, I think we just got Neena back.
Oh.
Oh.
No, I think she's gone again. All right,
No,
Tushar,
I
over
think
to you.
happy to jump on. I think where Neena was going with this was essentially to really focus on two things. Number one being the now we do have Neena back.
I wouldn't trust my internet. Go ahead, Tushar.
Okay, sounds good. Well, so in case your connection jumps off again. So I think where you were going, Neena, was to highlight effectively the positives, to really focus on the available strategies that business leaders can implement. And I know it's easy because we're watching the news, we're seeing these reports coming in from across the world. It's everyone, a significant portion of individuals are at home and able to see this now. So really focusing on the positives, really focusing on educating your workforce about protocols, procedures, what the benefits associated with them can be, why implementing a rapid antigen program to catch the possible asymptomatic cases that you would never know about. Jim talked about the iceberg, why these things are useful. And it might be a case of educating not only the workforce, but other members of your management team. And so I think it's very helpful to focus on education and making sure that you're sending across the proper message, backed by science, and really focusing on what can be done, rather than feeling as though there are not sufficient options available. There are options available, and yeah, that's what I would end off with. Oh, Sarah, we've got you on mute.
Yeah, there we go. I think actually all three panelists have had a very carrot over stick type attitude with all of this. So, it's all about explaining what options are available and communicating their value really to employees. It's not just about, making things mandatory or, mandating new policy changes. It's really about basically empowering the employees to make their own decisions, but sort of presenting all of these different tools that we have in our toolkit in the best possible light. So that's really great to hear your perspective on that. I think as we wrap up, I'd just like to say thank you so much to all of our panelists for joining me today. And thank you to all of our participants as well for listening in. And thank you again for the questions that were sent in, both in advance and also during the chat during the session. As a reminder, as we wrap up, if anyone's interested in following up with any of our panelists with any specific questions, particularly the legal folks, I'm sure there's lots of kind of nitty-gritty questions about specific businesses' cases. You can always reach out through your Communitech customer success advisor, and they'd be more than happy to put you in touch with the right people. So thanks everyone so much for participating, and we'll see you next time.